Hello everyone, here we are. Today we have our discussion on a very common symptom and a very common presentation of diseases, that is jaundice. I am Dr. Riya Shahai, MD Medicine, and we have with us Dr. Krishanu Boni, gold medalist, DM gastroenterologist. And today we are going to discuss and solve all your queries regarding this very common symptom, that is jaundice. So, good afternoon, sir. And coming to our topic, what is jaundice and how would one know that he or she is suffering from jaundice?
Jaundice means raised serum bilirubin. There is one enzyme in our blood. It normally is there in our blood. This is bilirubin, a substance, not enzyme. Now it has a normal level. It is 1.5 or up to 2 milligram per dl in normal individual. When bilirubin level increases in blood, say if it goes above 3 milligram per dl, then it is called jaundice. And people would know about jaundice by yellowish discoloration of their eyes, of their skin. Sometimes the urine becomes yellow, and there are a few other associated symptoms. Simply, uh, people see that their eyes getting yellow, urine is getting darker, and one would suspect jaundice.
So, what are the very common causes of jaundice?
Yes, there are so many causes of jaundice. There are plethora of causes actually, but in our setup or scenario, most of the cases of which are clinically significant, which are to be treated, these cases are due to viral hepatitis. There are different kinds of hepatitis virus which can infect our liver. It may be due to some drugs, some medicines, or there may be a stone in common bile duct, or in some cases there may be some malignant or neoplastic tumorous causes. So these are the and also alcohol. Those who do intake alcohol for a longer time, chronic alcohol use disorders, most common causes of jaundice.
So, is jaundice dangerous?
It can't be answered in a simple sentence. Sometimes there is condition called Gilbert syndrome. So, in general population, around 5 to 15% of people will have Gilbert syndrome. Their eyes will get yellowish on and off. This is a very benign cause of jaundice. It does not need any treatment in most of the times. So, in that scenario, jaundice is not at all dangerous. But yes, if jaundice is there due to alcohol or due to viral hepatitis and some medicines, or stone in your common bile duct, or if there is any tumorous causes, then it is to be treated. Not dangerous. It may be dangerous sometimes, but most of the cases it is not dangerous but to be treated.
So, now I'm coming to a very common question, a very common query of all.
Mhm.
What is the food items that one should avoid or take while suffering from jaundice?
Look, there is no direct relation between foods and jaundice, but there is one condition which is called pseudo hyperbilirubinemia or pseudo jaundice, where some foods like carrots, which contains beta carotene, if carrot is consumed in excessive amount, then it cause a yellowish coloration of eyes. So it is not actually jaundice, but excess consumption of carrot can cause yellowish discoloration of eyes. But it is not so that carrot should be avoided totally. There are some medicines which can cause yellow discoloration of our eyes. Like there is a medicine used to treat malaria, quinine. So it can also give rise to yellowish coloration. But quinine, when used, it is essential to be used. So it is not like that to avoid jaundice we should avoid use of quinine. It is not like that. And there is a common question people ask when they come with jaundice, that which foods to be avoided, are hot foods to be avoided, or cold foods, cold drinks to be taken in excess amount to reduce or treat jaundice. There is no such link of jaundice with any food. So nothing to be restricted. In simple word, do not restrict your normal diet. If you are able to take your meal without any vomiting or tendency of vomiting, these symptoms may sometimes be associated with jaundice, then you do not need to restrict your diet. Rather, you should take a healthy diet, balanced diet, even if you are having jaundice. So this is a very important thing and a very important query. Everybody always thinks that they should avoid a lot of food items, yes, which is not the case. Rather, yes, a balanced diet is needed. Yes, absolutely, absolutely. Okay, so and another question, a very common query, is jaundice contagious? Jaundice is not contagious, but there, if the jaundice is due to viral hepatitis, there are two groups of viral hepatitis. One is waterborne, which spread via fecal-oral route. That means taking food with improperly cleaned hands, or taking contaminated water can spread jaundice. These are hepatitis A and hepatitis E like causes, which spread via these routes. And some jaundice are bloodborne or sexually transmitted, like hepatitis B, C. These causes spread via uh, intake or injection of blood products, sharing contaminated needles. Those who abuse IV drugs, or people who take drugs in their veins on their own, and who share needles, so this can transmit this type of jaundice. And in some cases like hepatitis B, during childbirth, these infections can be transmitted from mother to child. Otherwise, jaundice is not contagious. In relation to the last question, one should also remember, apart from a balanced diet, clean drinking water is a necessity. Yes, of course. Clean drinking water is means to avoid contracting jaundice. Fecal-oral, yes, 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 transmission of, yes, A and E. Yes. So now coming to our next question, there are some medicines which are widely used in case of jaundice. So will you like to throw some light on them? Yes, people try so many things when they get jaundice. These are uh, ursodeoxycholic acid like medicines. There is one medicine called obeticholic acid, or OCA. But for all nearly all practical purposes, or I can say that in more than 95-99% cases, there is no medicine which can cure jaundice. Jaundice is to be cured by diagnosing the actual cause of jaundice, and if it is treatable, then to treat that actual cause. But there is no solution for all causes of jaundice, and especially there is no much role of these medicines which you mentioned, we have just discussed. So, while when a patient comes with jaundice, what are the tests that are normally prescribed for diagnosis the cause of jaundice? So the tests depend upon the clinical scenario. Suppose a patient comes to us, uh, he's having fever for few days, and there is body ache. Now the fever goes off and his eyes and urine are getting yellowish. So in that cases, the jaundice is most commonly due to viral hepatitis. Now we commonly prescribe some blood tests, some serological markers which can detect this viral hepatitis, and one ultrasonography. So these are the basic tests to know the cause or get an idea about the cause of jaundice. And in another scenario, suppose a patient comes to us with pain in his abdomen and sudden onset of jaundice, there is itching, stool is getting pale, sticky stool or whitish stool, and urine is getting darker. So we suspect there is some pathology in common bile duct. There may be stone. So in that case, we can prescribe MRI of common bile duct, which is commonly known as MRCP. So these blood tests and imaging tests like ultrasonography, MRCP, these are the most commonly prescribed tests for jaundice. And in another scenario, suppose all these investigations do not point towards a single cause of jaundice, then we may have to prescribe liver biopsy as one of the last resorts to diagnose the cause of jaundice. So these are the three different groups of tests we generally prescribe to diagnose jaundice.
So, after now diagnosing jaundice, what are the common modes of treatment?
As we have already discussed that jaundice is to be treated by treating the cause. There is no single drug or medicine which can cause jaundice. If the jaundice is due to, suppose, hepatitis A or hepatitis E, then we just treat the patient symptomatically until and unless the patient is not having features of liver failure. Then we give symptomatic treatment, and in a span of 1 to 3 months, generally, this jaundice goes off. Suppose the jaundice is due to a stone in bile duct, then we have to remove that stone by means of ERCP, that is endoscopic retrograde cholangiopancreatogram. This is one treatment modality of jaundice. And if the jaundice is due to, suppose, alcohol or some medicines, some drug induced hepatitis, then we uh, ask the patient to avoid alcohol, and we try to understand which drug is the culprit, and we just avoid uh, the intake of that drug if it is not essential. So these are the different modalities of treatment of jaundice.
So now we have discussed the treatment. Coming to a few questions which are very commonly asked by patients. One is, does jaundice increase in sunlight?
No, actually not. Yes, this question we generally very often hear in our clinic, that should I be at home or I can go to work. So it is to be reiterated that jaundice does not increase by going into the sunlight. So if you are physically fit, if you are eating your normal diet, you don't have any vomiting or very much weakness, then you can continue your daily activities. There is no such thing that one should not go into sunlight or so.
And what is the minimum days of rest one should take?
There is also no such rule that uh, rest helps curing jaundice. Uh, Again, I would say the same thing, that if you are physically fit, if you are not feeling very unwell, then rest is not at all essential to treat jaundice.
Another question, which is also very commonly asked, does jaundice recur?
Yes, obviously, in some cases, jaundice can recur. Uh, Suppose in India, uh, one of the most common causes of chronic liver cell failure is alcohol, hepatitis B, So in those people who continue to take alcohol, jaundice may recur. And in viral hepatitis, generally hepatitis A and E do not recur. They occur once in a lifetime. But in case of hepatitis B, there may be recurrence of jaundice, because in 5% patients, hepatitis B can lead to chronic hepatitis. So in those cases, jaundice may recur. And in some cases, suppose there is bile duct stone, uh, there may be recurrent stones. So in that case, jaundice may recur. Otherwise, in fully treated causes, jaundice should not recur.
So, coming to the end of our today's discussion, thank you, sir.
Thank you. Thank
I
you so
hope
much.
this will be a good insight for everybody suffering and worrying about jaundice.
Yes, you have raised the very pertinent and burning questions. I think this discussion will help people a lot. Thank you. Thank you for raising such questions.
Thank you.
Thank you.